And so we often put our healthcare last. So I feel like this also gives women the opportunity to say, hey, I'm taking charge of my health and I can do it in a way that's convenient for me and meets my needs. Like, why should you have to take a full day off of work to go sit in a waiting room to then have a 5-minute appointment with someone that leaves you with more questions than answers?
Welcome to the Suburban Warrior Podcast, the podcast that inspires, educates, and empowers women navigating the chaos of midlife, perimenopause, and menopause. I am your host, Chrissy Pfeiffer, a holistic health coach and fierce advocate for women's wellness. With a background in nursing, the pharmaceutical industry, and integrative nutrition, I blend medical expertise with a holistic approach to help women heal naturally, integrate science-backed therapies, and take control of their health. After enduring my own 10-year battle with perimenopause symptoms, I've made it my mission to ensure that no woman has to suffer in silence. Join me as I share expert insights, real-life stories, and actionable strategies to help women reclaim their vitality, prioritize their well-being, and redefine midlife wellness with grit and grace. What's up, warriors? Welcome back to another episode of the Suburban Warrior Podcast. I'm your host, Chrissy Pfeiffer, back this week with another awesome Suburban Warrior here to share her story and expertise with us. Before we get into that, I want to quick remind you to visit suburbanwarriorpodcast.com. We have a free download there, which is the From Pause to Power Roadmap. And basically, this is everything from soup to nuts, A to Z, all of the information that I wish I had about 10 years ago when I was starting my perimenopause journey. It's there for you in a free download, and you can check it out, bring it to your physician's office, talk to your healthcare practitioners about it. It's all the information right there in one place for you. And while you're there, be sure to sign up from our Pause Like a Warrior newsletter. It is basically the top tips of the podcast each week summarized into one simple newsletter delivered right into your inbox. So be sure to sign up for that while you are there. So let's get into this amazing episode this week with my guest, Dr. Raina Gazurian. She is a board-certified physician in family medicine and geriatrics with over 15 years of experience as a primary care physician. A graduate of Drexel University College of Medicine, she completed her residency and fellowship at Thomas Jefferson University Hospital in Philadelphia. After years in the traditional healthcare system, she founded Lanai Health, a direct primary care practice in Doylestown, Pennsylvania, out of a desire to restore the meaningful doctor-patient relationships that true healing depends on. She's passionate about empowering women to take charge of their health through every stage of life, helping them navigate midlife with confidence, balance, and self-compassion. Welcome to the podcast, Raina.
Thank you so much for having me, Chrissy. This is exciting.
I know. This is so exciting and so fun. And I'm really excited to hear more about you and about your journey and, sort of why, what led you to really starting your own practice. That's a little bit different than outside of the traditional medical system. So First, tell us a little bit about you.
Sure. So like you mentioned in my bio, I am a family doctor. And I really, when I was deciding to go to medical school and then picking my specialty, I kind of liked a little bit of everything. I liked, the idea of getting to know people and following their stories and having relationships with them, and then also getting to help them navigate their health and diagnosing conditions and really using those relationships to help them heal.
Yeah.
And I quickly found out that the healthcare system is not really set up to allow us to do that.
Yeah.
It is really targeted towards, unfortunately, like large corporations, namely insurance companies, making a profit and not really about patients necessarily being well. It focuses mainly on sick care and very episodic care. So, I have a sinus infection, I should go to the doctor, but then I might not see them for years, and I'm not focusing on my wellness and how to keep myself well and healthy and focus on my lifestyle and balance and things like that. So I trudged through practicing for mainly hospital-owned practices in the greater Philadelphia area. And I just kind of hit a wall recently last year where I felt so burnout. And I had a patient who was one of my favorite patients who had actually followed me like along my journey to different practices. And she came in and she was just not her usual self. She was like someone who was just very bubbly and always wanted to share stories, etc. And she was just sitting kind of quiet. And I said, what's going on? What's wrong? She's like, I was sick 2 weeks ago and I called, and the front desk not only wouldn't let me schedule an appointment, they wouldn't let me speak to you. I left several messages and no one got back to me. And she's like, I'm just so disappointed because this is the whole reason I wanted a primary like you. And I felt really gutted because I was like, this is exactly what I want too, and what I want to be able to give patients. And I just feel so disappointed in myself and the system and everything that's going on here. And I think that same day or maybe the next day, I was at home, and my daughter, who's like my really easy child, who never really asked for anything, was like, Mom, can you do X, Y, or Z with me? And I said, I have to finish charting. And she said, you're always working, like you're not even here with us most of the time. And that too was like, oh my God, I'm failing at home too. So I'm failing at work, I'm failing at home. What is the point of it all?
Right.
And I was supposed to be going to another employed position, and that fell through for contracting reasons. And I just said, this is the universe telling me it's time to do something different, to try to regain what I love about medicine and give me time to be a mom and, develop myself as well. So direct primary care had kind of been in the back of my mind. And so I decided to just go for it because it's a model that really values putting the doctor-patient relationship first and cutting out all middlemen and paperwork and billing and coding and all the things that get in the way of us truly being able to talk to each other, talk openly, and have counseling and a lifelong relationship.
Yeah. So explain to us, what does that really mean? What is direct primary care? How is that different than, what we're used to?
So direct primary care is a membership-based option. So there is no insurance at all. So patients pay a direct fee to their physician for all of their primary care needs. So that means, a physical, a sick visit, maintenance of chronic conditions, medication refills. It means access to me and just me. So I have no employees. So when you're calling, you're getting in touch with me. When you're texting, you're getting a response from me.
Right.
And the whole idea is that, number one, it's completely transparent. Like there's no hidden costs. It's not like, oh, I wonder how much it's going to cost if I come in this time. It also means that it's available and accessible when you need it. And again, it cuts out all of that, middleman telling us how long we can spend together, telling us that we can or can't do video visits, telling us that I can't come to your house because I can't bill for that. So it really makes the care more focused on the individual and what they need and deserve.
Yeah. Right. So, and obviously it's very highly personalized, right?
Yeah.
I mean, most people aren't texting their physicians directly or calling their physicians directly. And to your point, like, with your patient who was just even trying to get an appointment with you in your office, she couldn't even get access to you or get a message to you that, something was going on. She couldn't even get a message to you,
Exactly.
let alone speak to you directly. So it's really, it's so highly personalized. And I also like to think of it as it's almost like going back to the olden days, right? When you had, when there was like a town physician.
Yep.
And he took care of the whole town.
Exactly.
And, he would be, or she, I guess, but most of the time I'm sure it was a he. But would do house visits and he knew everybody and he knew what was wrong with them and he took time to talk to patients. And so it's kind of like hearkening back to that type of model, right? Where your physician actually knows you and knows what's going on, with you, and you're not getting like, a 20-minute well visit and then you call for sick visits and can't even get in.
Right.
See.
Exactly. And you're seeing the same person every time. I mean, that was also even from the physician side of things. Like if I'm seeing a patient who had been seeing someone else in the office, that's fine. It's something that we have to do for each other, but it made it so disjointed, and the patient has to tell their story over and over again. And that's frustrating, and things get missed and balls get dropped. So yeah, it's for both sides of the relationship, really, for both the provider and the patient.
Yeah. And I would imagine too, like obviously, like, a lot of physicians go into to this line of work because they want to truly help patients and they want to make a difference in the world. And then, like you said, then you start practicing and realize so much of our medical system is run by insurance companies, pharma companies, private equity companies,
Yep.
VCs, like, I mean, there's so much corporations, so many corporations behind a physician's office that, like, I
Right.
think typically most people don't realize. And I only know because I talk to so many physicians
Right.
and hear so many of their frustrations over the course of, really the last, I would say, 5 years. I feel like it's gotten so much worse, but for, not just for patients but for physicians, and patients are really frustrated because they're going in and I always use the example of women in midlife, who are in their perimenopausal journey, and they're showing up to their OB/GYN office at their well visit expecting to have a long conversation about their menopause journey, but they can't. I mean,
Right.
even if their physician wants to, they cannot. They don't physically have the time to have that conversation with their patients. So then they get pushed off and say, "We'll come back in 3 months and we'll have another conversation." But a lot of those women can't wait for another 3 months.
Right. And sometimes it's just deja vu all over again. You come back in 3 months, you see
Yes.
someone else, you have to repeat the whole
Right.
thing over
Right.
again.
Right.
So, yeah, I think especially for women in general, no matter what, like your station in life or your, family situation, we tend to put ourselves last to begin with. Like we're
Yeah.
caregivers, like that's just our nature. And so we often put our healthcare last.
Yeah.
So I feel like this also gives women the opportunity to say, hey, I'm taking charge of my health and I can do it in a way that's convenient for me and meets my needs. Like, why should you have to take a full day off of work to go sit in a waiting room to then have a 5-minute appointment with someone that leaves you with more questions than answers? So
Right.
I love when like my patients text me and say, "Hey, I'm at lunch. I have a few minutes. Can we just talk about this? Or do you think this medication would work for me? Is it something that we should talk about more?" Because a lot of those things we can talk about quickly, and it doesn't have to be a full visit that you have to interrupt your whole life for.
Right, right, exactly. And I think that's a great point because I think that's another really frustrating point about just, if you want to go to the doctor's
Yeah.
office, a lot of times it is like a quick little thing.
Mhm.
And then you call, I mean, it could be anything. I'm even talking about like a dermatologist, like any appointment, it could be like so quick, but it has to be like, oh, you call, you wait for the appointment, you're not getting in for a couple weeks, you finally get in, then you're waiting. It's like the whole process. It seems like we just need a major overhaul of the
Absolutely.
healthcare system, just in the sense that you even said it really is a sick care system.
Yeah.
And we're not partnering with, physicians and patients. There's not really that true partnership to really help manage your whole body system
Hmm.
in a sense of wellness, right?
Right.
And so, I mean, that's why I have clients because, when I'm able to sit and have these conversations with clients about lifestyle, about diet, about moving their body, about supplements, about, sleep, about stress, about breath work, about meditation. I mean, all of the things, what's happening emotionally in their home, like all of these things that really apply
Right.
to our actual physical health, right?
Yeah.
And so now, okay, so we talked a little bit about, how it's no insurance, but yet if you order tests or prescribe medications, that's all covered by insurance, correct?
Absolutely. So, the
Yeah.
vast majority of patients still carry insurance through their employers or whatever it might be. So it's
Right.
not like you drop your insurance. You use your insurance for what you would like to use it for.
Right.
And
Right.
the very interesting thing about this whole journey that I've learned is that sometimes even paying out of pocket for many things, tests, labs, can be a lot more affordable if you don't use your insurance because your copays are astronomical. So I also, try to help patients navigate that as well and come up with the most
Yeah.
cost-effective solution. But yes, it does not mean that you can't use your insurance or shouldn't use your insurance. It's just that
Right.
for the sake of the primary care relationship and to free us from like being enslaved by that system, that we don't use
Right.
insurance.
Right, absolutely. Yeah, and I think that's important to note. Just right, it's not like everything's out of pocket. It's just really the membership fee for the access to, physicians.
Right.
I thought what you were going to say is I do think that when we pay out of pocket for things, we feel more empowered to make different choices for
Very true.
ourselves and feel more empowered to stick with a program, feel we're just more likely to really be engaged, I feel like, in that journey.
Right.
And I mean, what more of a journey should we be engaged with than our own healthcare and our
Exactly.
own wellness journey, right? And our own bodies. Do you see that with your patients?
I do think that DPC, direct primary care, does tend to attract patients who are more just self motivated, who are really at a place where they're committed to their own healthcare, which is awesome. Like, I love that.
Yeah.
But I'm hopeful that, as more and more people get frustrated with the system, as insurance gets more expensive and, those of us who are self-employed or can't afford it, that it
Yeah.
also is an affordable alternative for folks to get care and then, realize that it also allows them to really pay attention to themselves and not just be a number in the system.
Yeah, exactly. So, what do you think is the biggest difference you see with your patients once, transitioning from traditional healthcare to DPC? What do you think one of the biggest like benefits or changes is that you see with your patients?
I mean, I think the time that we get to spend together is probably the most important piece of it. So my office is not really set up like a traditional doctor's office. I mean, I do have an exam room, but it kind of looks like a living room. So most of the time we sit on the couch, we spend however long the patient wants to just discussing their history and what's been bothering them or, their goals, and it's much calmer. I when I go to the doctor, I don't feel comfortable, getting undressed and sitting on that, paper on top of the table.
Yeah.
Like, it's uncomfortable, it's embarrassing, like you feel exposed. So I feel like it just already shifts the mindset that like this is a well place, a calm place, like a place where we're gonna, have the time to really focus on you. So I love that. Like I love that for myself. Like I feel calmer in my practice.
Yeah, absolutely.
Yeah.
I mean, it's so much more. I was just at the Menopause Society meeting a couple weeks ago,
Hmm.
and they were talking about different studies. And one of the things that they talked a lot about is white coat syndrome,
Yeah.
how you really can't measure a patient's blood pressure when they're in front of you in the office because so many people have white coat syndrome where their stress levels go through the roof. Even if they're not physically presenting that way, it's like a mental thing. And
Right.
so you really have to send them home and say, take your blood pressure a couple times, because in the office it's not really accurate because of white coat syndrome.
Absolutely. And I've seen that a lot too, that, we can sit and talk for a while and sometimes I'll just bring the blood pressure cuff up to like the sofa and take
Yeah.
a blood pressure there because it's true. Like the whole experience is the like clinical experience makes you nervous, whether you're
Right.
just
Right.
about your health or not. So I really do love that about my practice.
Yeah. So what advice would you have for someone who is, I mean, obviously my listeners are all women in midlife, so
Yeah.
specifically for them. But like, what advice would you have for them if they are feeling really frustrated, gaslit, not heard,
Yeah.
spinning their wheels, not getting anywhere? Like, what would be your advice for next steps?
I think finding that provider, and I know it can feel like a full-time job and like you can get turned off very easily after having a bad experience, but I really do think that finding the right provider, whether it's a physician like myself, whether it's you as a health coach, like finding that person who will listen to you and be your advocate,
Yeah.
because there is something quote unquote wrong, even though it's a natural stage that we're going through. We shouldn't have to feel, exhausted and completely unlike ourselves. And, there are a lot of treatments, as you know, and many of them
Yeah.
are lifestyle changes and just require the right like coaching and support and mentorship. But you can feel better. So you shouldn't just allow someone or the system to tell you like it's all in your head, your labs are normal, you're fine, go, do your
Right.
thing.
Right. Yeah. So I'm curious, as a woman and you're a physician, have you ever felt that way? Have you ever
Oh,
felt dismissed by another physician or gone into a doctor's office and felt that way?
absolutely. I would say, I mean, you can probably relate that most of us in healthcare make the worst patients and often like
Yeah,
delay our own
totally.
appointments and,
Right.
just curbside each other.
Self-diagnose,
Yeah.
self-treat, do it
Yep.
all. Yeah, yeah, yeah.
Exactly.
Right.
But I actually had a little bit of a health scare over something about a year and a half ago now. And I purposely went to someone I didn't know because I wanted to really be a patient. I wanted to, like, of
Yeah.
course, I know what all this means and I know the steps and all that, but I wanted to be able to say, I'm scared about this and I just need someone to reassure me and be there and, be my point of contact. And they were very much like, oh, well, you're a doctor. You know exactly what's going to happen.
Yeah.
And thank God, because it's saving me time because I don't have to explain you everything. And it was just very impersonal. Yeah,
You're like, that's not what I came here to hear.
right. That's more about you and less about me.
Yeah.
So, yeah, it just felt very dismissive. And luckily, everything worked out fine. But if it hadn't, I really
Yeah.
didn't feel like I had an advocate or a shoulder to cry on or anything. So that too, like being a patient always reminds me why I'm doing this as well.
Yeah, yeah. Well, I'm sorry that you had to go through that, and I'm glad to hear that everything is okay.
Yeah.
But, I guess it's perspective, right? It gives you that perspective of being on the other side. And, I also think, as just physicians that, oh, they don't ever have that experience. But again, the more and more conversations I have, specifically with physicians that are like our age, I'm assuming that we're probably
Yeah.
around the same age,
Yeah.
and a lot of the women I speak to are as well. Again, they have all had, the same similar like dismissive experience, where they just walk out feeling really horrible.
Yeah.
And, I wish there were something that we could figure out to change that feeling for women,
Yeah.
because you shouldn't be walking out of your doctor's office feeling worse than when you went in.
Right.
The whole
Exactly.
point of going to the doctor's office is to feel better, not worse.
Well, I think the more of us who just demand this, whether it's,
Yeah.
going outside of the traditional system or, not stopping at that one person and saying or complaining or, asking to see someone else. I think the more of us who speak up for ourselves, the better it will be. Of course, it's a behemoth. Like it's been years and years and years in the making, and they have so much control. But I think the more all of us just speak up and say, like, this isn't, what is this? It's not even care. It's just, wasting my time, really.
Right, right.
But I personally like truly believe that direct primary care is a way out of that.
Yeah.
And especially for folks who have been very dismissed by the system, it at least gives you that time, that relationship, that advocate. Hey, maybe I know that I don't know everything and I know that I can't figure everything out, but I can at least walk the journey with you and help you along the way.
Yeah. So for you too, I'm assuming like it's been such a better balance in your life too, because now you have control of your own schedule. You control how many patients you see. So it's
Right.
been so much like more of a balance and better quality of life for you as well.
Absolutely. I mean, I can see many fewer patients than if I were like an employed physician somewhere else. And again,
Right.
it's not churn and burn like one patient every 15 minutes. It's hey, I have 5 new patients today and I spent an hour and a half
Yeah.
with each of them and I still get home in time to make dinner and hang out with my kids. And when someone calls me, I know that patient. It's not just some random person whose whole history I have to look up online. It's a patient
Yeah.
that I know very well and, we can have a quick conversation. So it's not an interruption to my life. It's more of just, another relationship that needs attention. So yes, I am in a much, much better place personally than I was as a physician in the system.
And was that, I'm assuming that was a bit of a scary transition for you to make, to sort of leave that quote unquote the comfort
Yeah.
of the system and start something on your own.
Yeah, it's still very scary. And I'm flexing different muscles, like
Yeah.
the whole, like networking piece and putting myself out there and advertising and branding. And that is not something you ever have to do when you're employed
Right.
as a physician.
Right.
But it's exciting too. Like it's all my own on my own terms, like being authentic. So
Yeah. True to you.
yeah. So yeah, it's
Yeah.
scary, but it's scary in a positive way, I think.
Yeah, because I again talked to physicians, and just last night was at a grand opening of a friend of mine who just opened her own like menopause specific
Yeah.
practice, around here on the main line where we live.
Uh-huh.
And so that was full of different physicians, family practice, OB-GYNs, and a lot of them I was having this conversation with a lot of them that it's just it's really scary because your profession, you're not taught to like be entrepreneurs or, you be business owners. But
Yeah.
a lot of people are now choosing to kind of take their specialty and also be business owners.
Right.
But it's given them so much more freedom
Yeah.
and happiness to be able to serve their patients in that way.
Right, of course. I feel like our generation, like physicians, like in our age group, were kind of taught like you can't afford to have your own practice because of the overhead and the billing. And again, it's all because of what we have to do to answer to the insurance companies.
Right.
So I think that was just kind of beat into us in a way to like keep us in the system
Yeah.
because the more of us who do independent things, the less powerful they are. But it's totally doable. Again, sure, it's scary and you have to learn new things, but we had to learn a lot of things along the way and are definitely capable of doing it.
Yeah, absolutely. And it's really funny to think about, just to go back to what you said about how you were kind of taught like you can't do it, it's too expensive. And, it's funny how things have just changed over time. Like even when I think back to like when I was a kid and going to the pediatrician, like I had one pediatrician I did, that I saw like my whole adolescent, from a baby to adolescent life, until I went to a family care doctor and then had that same family care doctor growing up. Again, small town, but very different than the experience when I was bringing my kids
Hmm.
to the pediatrician, right? And then it was I was lucky if I got to see the same doctor
Right.
twice. And if it was a sick visit, most of the time not seeing the same doctor. And so, the healthcare system is really morphed into this big behemoth of just this corporation of,
Exactly.
keeping things going. And, hopefully we'll start to see the reverse with things like personalized medicine,
Sure.
and people choosing that, choosing that for themselves to, keep themselves healthy and well, because really that's what it's all about. I mean, if we're not choosing ourselves and putting ourselves first in that way, then
Then what's
that's, and not waiting until something's wrong, right?
right.
I think that's another key and a really important point, because I think a lot of people wait until either they have a chronic health condition that's gotten out of control, or they get a diagnosis, and it's about setting yourself up with your healthcare partners before anything like that happens, so that when that does happen, you're not as stressed because you have people to help guide you.
Sure.
Right.
Yep, absolutely. And it's not
Yeah.
to
And then
say,
do you have, I was just going to say, do you have like a whole network of like other specialties and specialists that you refer to as
yeah,
well?
and that's something that I'm really working on right now, because I spent most of my time in practice in Philly. So Doylestown is
Okay.
kind of a new area to me.
Oh,
So I'm
okay.
getting to know folks and building a network. And that's been really fun too, because then you realize like people are doing really amazing things and like just thinking outside of the box. And
Yeah.
but I am really trying to build a network of people who are like-minded, who, whether
Yeah.
they're within the system or outside of the system, really want to advocate for patients. And their whole values and just way of thinking is about putting the patient first. So that's been exciting too, to be able to get to choose that network versus like, oh, you work for this hospital, you can only refer to these people.
Yeah.
So that's been really exciting as well.
Good. So let's talk about like, your patients, specifically like your women in midlife. What are you seeing? Like what they're coming to you, what is normally like, do you have like a chief complaint or something that is the number one thing that you think is driving them to you
Yeah.
at this point in their life?
I feel like it's generally like fatigue and weight gain.
Yeah.
Like
Yeah.
I woke up overnight and I just don't feel like myself anymore. And I haven't really changed anything. And I don't understand why, like, I have this pooch and I'm working out and I'm eating right. And I just don't get it. And, I'm one of them too. Like, and I'm like, I don't understand.
And
Yeah.
that's me as well.
I'm doing
Yeah.
all the
Yeah.
things. Why isn't it
Yeah.
working?
Yeah.
And I
Yeah.
think it's, first of all, it's really nice to be able to say like, I get it, I truly get it, and have
Yeah.
that conversation from like a very friendly and understanding place, and then really talking about the ins and outs and what's available in terms of perimenopause and menopause treatment, which it's been a big week for estrogen.
Yes, it sure has.
Yeah.
Yay.
Yeah.
Finally. Let's talk about that a little bit because I had a lot of conversations, people asking, people reaching out. They're like, because people outside of, healthcare or pharma don't truly maybe understand what the weight of like just removing the black box warning
Yeah.
means.
Right.
So, obviously the warnings are still in the package insert, which the
Sure.
package insert is like the little leaflet that comes in the package with medication when you get it from the pharmacy. So the warnings haven't been removed,
Right.
but the black box warning has been removed.
Right.
So explain to us a little bit about, I mean, I know, but I'd love to hear
Yeah,
from you,
sure.
what that means.
So, a lot of the kind of fear of hormone replacement therapy for menopausal symptoms in women of menopause age came from some studies, some large studies that were done over 30 years ago. And that data has been reviewed. And while we know estrogen has certain effects on the body that can increase risk for heart disease for certain patients, risk of certain female cancers, it overall does not necessarily cause those things. So for
Right.
many, many years, physicians were sort of taught just to stay away from it because it was too risky. So women suffered through, things that estrogen therapy can definitely treat, and can
Right.
sort of ease that suffering. So I think it's revolutionary that now we can tell patients, here are the potential risks, like every medication has.
Like every
Every
medication. And I
medication.
and I think that's a really such an important point to highlight because estrogen has been so demonized,
Yeah.
but yet we prescribe it, not we, I don't prescribe it, but you guys, the doctors and we take, I mean, people are taking birth control pills,
Yeah.
I mean, dishing them out to teenagers for
Right.
acne and, everything under the sun. And there's a risk there,
Right.
in that. And so I just think it's so important to highlight for people that no matter what you're taking, any kind of pharmaceutical and anything, even supplements that you're taking can have risk to them. So everything that you're putting in your body has risk. I mean,
Right.
shit, the food that we eat now has risks to it,
Exactly.
right? So like everything has a risk to it. And it's really what is the relative risk compared to what you are dealing with.
Yeah.
And that is a personal decision for every woman
Exactly.
to be able to decide.
But the black box was like a blanket warning that like
Yeah.
all women should avoid this like the plague. And so that being
Right.
removed, I think is just a huge win. I always compare it to like you said, every medication comes with a potential risk. And think about how
Yeah.
many people like want a Z pack for every like cough, cold, whatever.
Right.
Azithromycin or the Z pack is really high risk can cause cardiac arrhythmias, but everybody, a lot of people take it like candy. So
Yeah.
again, it comes down to your personal risk, your history, risk versus benefit for everything, for everything we put in our bodies.
Yeah, yeah. And having that black box warning removed, the black box warning is normally reserved in the pharmaceutical world for like scheduled products, opioids, things that have extremely bad side effects. So that's why, having that on estrogen was such it was just horrible because
Yeah,
it was even on vaginal estrogen, which people say, really isn't even absorbed systemically, which,
right.
who knows? But like it's just having it removed, I think opens up a lot of people's physicians' comfort level to prescribe and hopefully patients' comfort level, again, just to do their due diligence, just like they would with any other medication that they're taking
Right.
to see if it's right for them.
Yep.
Yeah. So it was a big week for women and in women's healthcare for
Yeah.
sure. Well, Dr. G, tell us where people can find out more about you and your practice.
So my practice is called Lanai Health. That's Lanai Health. And if you Google Lanai Health in Doylestown, you can find my website. And it's easy to either become a member or schedule a meet and greet straight from the website.
Wonderful.
And I offer a free meet and greet for anybody who's interested. And we can do it in person, we can do it online, we can do it via phone call, we can do it even via email if it's easier for you to just ask your questions that way.
Yeah.
And that's all so that you can explore and make sure that it's the right fit for you, because obviously I want it to be the absolute right fit, because that's the whole point.
Yeah. And then do you also have patients that you see that like might be live further away that you would do virtually, or are most patients in that area?
Absolutely. I mean,
Yeah.
I like to meet patients wherever they are. I think it's always nice to do an in-person meeting just so that, we truly get to know each other, but I don't require it. And if it's too far, if, you want me to come to your house, I'm fine with anything. Or we can do everything virtually until we really need to do a physical exam.
Right, right. Okay, great.
Yeah.
Well, thank you so much for being here today
Thanks
on the
for having
podcast.
me.
I really enjoyed our conversation, and I think what you're doing is so important, and it's just an amazing option for people to have to be able to really choose a more personalized path for their healthcare journey. And, I love that you're doing it. I love that this model is, popping up more and more. And I know it can't be easy to make that decision and, go out on your own, but I'm really glad that you did because I'm sure you're serving your patients in such a more impactful way. And, that's everything.
Thank you so much, Chrissy. I really appreciate you having me, and thanks for being a warrior for us ladies.
Oh, absolutely. Absolutely. Well, guys, thank you so much for listening to the episode this week. And be sure to leave us a comment and be sure to follow Suburban Warrior Podcast so that you don't miss any upcoming episodes. And we'll be back next week with another amazing Suburban Warrior here to share her story with you. Talk to you guys later.